Many start their day with a single habit, swallowing a white pill, like Nexium or Control-Lock, before they even pour their first cup of coffee, a ritual designed to freeze heartburn or to protect the stomach lining from other medications. In this context, the medication acts as a reliable daily bodyguard. It's the first line of defense that allows for a comfortable day, free from the burning sensation of acid reflux. Yet, patients frequently find themselves spending months in specialist offices, seeking answers for lower back pain, weakening bone density, or unexplained tingling in their hands. When medical histories are cross-referenced, doctors often find that the onset of these structural and nerve issues aligns precisely with the long-term use of that same stomach medication. Taking these pills for years without clinical supervision can lead to a systemic breakdown, quietly impacting the body's structural integrity and its nervous system. We often view stomach acid as a biological error, a source of pain requiring suppression. However, hydrochloric acid is a precision tool with a specific chemical purpose. This acid acts as the primary catalyst required to dissolve the complex matrix of the food we eat. Without it, the body cannot access the raw materials tucked inside our meals. As the acid interacts with food, it triggers the liberation of vital nutrients into the bloodstream. This process is how the body acquires calcium for skeletal strength, iron for healthy blood, and vitamin B12 to maintain the protective coating of the nerves. When acid production is suppressed, the heartburn stops, but the chemical reaction required for nutrient extraction stops along with it. Proton pump inhibitors, or PPIs, target microscopic stomach pumps, valves that regulate acid flow. Unmonitored long-term use twists these valves shut, ceasing acid production. With valves locked, food moves through largely unprocessed, leaving calcium, iron, and B12 completely trapped and inaccessible. This creates a direct path to the symptoms mentioned earlier. Without calcium, bones become brittle. Without B12, the brain's memory centers struggle, and the nerves begin to signal pain and numbness. Over time, the body's most critical systems are starved of their building blocks, turning a functional digestive process into an inefficient, empty conduit. PPIs serve a vital role when used as intended, specifically for treating acute ulcers or H. pylori infections. In these cases, they are a temporary medical intervention, not a permanent lifestyle choice. Quitting suddenly triggers rebound acidity. The stomach overcompensates, causing acid levels to spike to painful, aggressive levels. To prevent this, doctors use gradual tapering. By slowly reducing the dose and temporarily using gentler H2 blockers, acid levels return to a healthy baseline without the surge. For those currently taking the medication, timing is essential for it to work as intended. The pill should be taken exactly 30 to 60 minutes before breakfast, which is when the biological pumps in the stomach are naturally preparing to activate. Escaping dependency requires a calculated approach. A sudden stop often results in immediate, severe symptoms that drive patients right back to the medication. There are specific scenarios where PPI use becomes high risk. For example, heart patients with stents who take the blood thinner clopidogrel must be extremely cautious when using omeprazole. This diagram illustrates a dangerous chemical conflict. Omeprazole stalls the very enzyme in the liver, CYP2C19, that the blood thinner needs to become active. If that enzyme is blocked, the blood thinner cannot work, leaving the patient at risk for a dangerous clot. The clinical solution involves switching to a different medication, such as pantoprazole. This alternative manages stomach acid while leaving the liver enzyme free to process the heart medication. Vulnerable populations face additional risks. For the elderly, long-term depletion of minerals leads to an increased risk of severe hip and spine fractures. There is also a common misconception that PPIs should be taken with antibiotics to protect the stomach. In reality, this change in acidity can allow dangerous bacteria like C. difficile to flourish, leading to severe infections. When used casually alongside other drugs or without professional oversight, these common pills create medical complications that reach far beyond simple heartburn. To maintain your health, remember that stomach acid is necessary for nutrient absorption. Long-term suppression can lead to bone and nerve damage. If you are ending a course of PPIs, avoid a sudden stop. Work with your doctor on a tapering schedule to prevent an acid rebound. Finally, be aware of drug interactions, especially if you are on heart medication, and always choose the safest version for your specific needs. take a look at your daily medications and the timeline of any new physical symptoms you may have. Share your story in the comments if you've experienced these side effects, and talk to your healthcare provider about a safe plan to manage your digestive health.